Welcome to the Systems Integration 2017 Annual Review and Open Enrollment. This is your annual opportunity to elect benefits and to make changes for a November 1st effective date. Please know you cannot come on our plan at any other time during the year unless you experience a qualifying event. A qualifying event is a loss of coverage beyond your control. For example, you're covered by your spouse and he or she loses his medical benefits. This would allow you to come on the Systems Integration Plan retroactive to the date you lost coverage on your spouse's plan. Other examples of qualifying events would be newborns, marriage, divorce, adoptions. Some of these situations may require proof of your loss of coverage. So let's get started. Systems Integration offers a comprehensive benefit package to all full-time employees working 33 or more hours per week. Your coverage becomes effective the first of the month following 30 days after employment. Systems Integration pays for the majority of your cost. They pay 55% for employees and dependents for medical, dental, and vision coverage, and they also pay 100% of your life and disability coverage for the employee portion. The health insurance. Our health insurance is with Cigna. There will be 3 options that are available to you. Dental coverage is also with Cigna, and if you are currently on the plan, there's a cost reduction. Vision insurance is with Advanica. That's a new benefit we are introducing in 2017. Group life and AD&D, long-term disability, short-term disability, and the employee assistance plan are with Mutual of Omaha. Short-term disability is paid in full by Systems Integration after 1 year of employment. We also offer voluntary benefits, which are 100% employee paid through payroll deductions. These include voluntary life and AD&D through Sun Life Financial, critical illness through Sun Life, and accident insurance through Sun Life Financial. So let's take a look at your medical plan highlights. Systems Integration offers 3 types of plans to fit your family's needs and budgets. Cigna's national network is available on all plans, Cigna Open Access Plus. There are no referrals required for any of the plans, nor do you need to elect a primary care physician. All plans cover preventive care at 100%. All plans have copays for common services and prescriptions. Deductibles range from $0 to $2,500 per person. The higher the deductible, the lower the cost. 2 plans are very similar to our current Healthy Blue and Opt-out Open Access. We are introducing a new base plan, which is a lower cost option with a $2,500 deductible per person. So which plan is better for me? This slide shows you the 3 medical plan options side by side. As a point of reference, if you are currently covered by System Integration's Healthy Blue plan with the $500 deductible, the option in the middle most closely mirrors your current coverage. You will also notice the premium is only slightly higher than it is now. The option on the far right, the high option, most closely mirrors the Care First opt-out and the HMO plans, which have no deductibles. These costs have actually decreased. On the far left is a new plan with a $2,500 deductible, and because of that high deductible, the trade-off is the employee cost is very low in comparison to the other options. When you look at the spreadsheet, you'll see that the items in bold are those that are not subject to the deductible. So for each of the plans, the copays may vary, but there are certain services such as primary care visits and specialist visits, urgent care, emergency room, and prescriptions that are not subject to the deductible. If they are in bold, they are not subject to the deductible. The deductible is highlighted in yellow, and it varies. On the far left, the least expensive plan, the base plan, there's a $2,500 deductible for a single, $5,000 per family. This deductible applies to things like surgeries and hospitalizations and imaging, MRIs, PET scans, that type of thing. Then if you would meet that deductible, then you would pay 30% until you hit what's called the maximum out-of-pocket, which is your worst case scenario, the most you would pay. For the high end, for the low base plan, the $2,500 deductible plan, the maximum out-of-pocket is $6,250 per single and $12,500 per family. So again, this is a little bit more catastrophic option. It's the lowest cost, but it also has many services that are not subject to the deductible. As mentioned, the two plans on the far right closely mirror plans that we already have that are currently in force with Care First. So these plans, the middle plan, has a $500 single, $1,000 family deductible, and that plan has a lower exposure, a lower maximum out of pocket of $4,500 per single and $6,550 per family. The copays are also lower. This plan, therefore, is more expensive, but as mentioned, is still similar in price to current pricing. The plan on the far right, the high plan, has no deductible in network. Everything is a copay. All the office visits and the prescriptions are a copay. This then would be our highest price plan, but the pricing is lower than it is currently. All plans also cover preventive care at 100%. So which plan is better for me? There are a lot of things to consider when you're using a plan. Remember, this is your annual election for the year. Usage. How much are you using or do you plan on using your benefits this year? If you're a lower end user and you primarily use your benefits for an occasional office visit and a prescription, you're probably perfectly fine with the base plan and you'll save a lot of money. If you know that you're having an upcoming procedure or a surgery, you may be better off with the high plan this year where you have no deductible and the lowest amount of out-of-pocket. If you're concerned about cash flow and you'd rather pay more via payroll deduction than have to pay more if you have claims, you may be more comfortable with the middle plan, the mid-price plan, that has a small deductible and a reasonable out-of-pocket. In all scenarios, you need to consider, do you have funds in reserve if you have a big claim? The network on all the plans is Cigna Open Access Plus, so it's the same. Preventive care is covered at 100% on all plans. All plans have co-pays for a lot of services. The main differentiator, of course, is the deductible and also the premium that you pay every month. Please note that the net cost to you is less than what is shown above. All our deductions are payroll deducted, and they are also pre-tax, which reduces your net cost by approximately 25%.
One of the major advantages to having a group plan is it allows employees to pay their premium on a pre-tax basis. So let's talk about POP. POP makes it easy to reduce taxes and save money. POP is also known as premium conversion, or under IRS Code Section 125, a pre-tax plan. It allows employees to reduce their taxes by paying for health, dental, and vision benefits on a pre-tax basis. The premium is actually deducted before taxes are calculated, and therefore it reduces your taxable income. And that's what allows you to increase your take-home pay. So if you look at the example in front of you, someone who did it before and someone who did it after tax. So the person on the left had the premiums taken out after taxes were calculated, and the person on the right did not. So the person on the right has a per pay savings because they applied POP of $17 per paycheck. And that's an annual savings of $408. And that's what I call stretching your dollars.
Are an important component of any plan design. In all three plans that we offer, the prescriptions are a copay, and they're generally the same between the plans. The generic prescriptions are between $10 and $15, depending on which plan that you choose. These are the most common medications, the ones that are available in bulk, the ones that have been on the market for a long time. The next copay is for a preferred brand prescription, which is $35. So these are prescriptions that do not come in generic. They're going to be more expensive medications. They still have ones that Cigna purchases in volume that have been on the market for a long time, and they're going to be a $35 copay. The most expensive tiers are non-preferred brand medications. These are medications that are extremely expensive. They may range from hundreds of dollars to $1,000 or more per month, and your copay is $60. There's also a specialty tier medication which has a maximum of $60. Again, these are expensive medications for MS, for AIDS, for cancer, that type of thing, and the most that you're going to pay is $60. One way that you can save money on prescriptions is to order them on a 90-day supply or by mail order. You will save half a copay if it is a prescription that is available by mail order. Specialty medications are not available by mail order. They're only available in a 30-day supply. Another point to note is that if you choose a brand name prescription and a generic is available and your doctor has not written this in a certain way, as dispensed as written, then you will pay the copay for the generic and the difference between the brand and the generic cost. So you'll pay a lot of money. So you need to make sure that your doctor has authorized you to take the brand medication and he's written it in a certain way that allows you to take that medication, dispense as written. Let's talk a little bit more about prescriptions. So just as an overview to help you save money on your prescriptions, which can be a lot of money if you take a lot of medications, you try to use generic when possible or lower cost preferred brand drugs. You can find all medications on mycigna.com. It'll give you an idea of the tier of the medication and if there's a generic available. Know what brand name drugs are covered under your plan. And again, if generic is available, you do want to try to use that. And you want to try to use mail order if possible because you're saving a copay, or to order prescriptions on a 90-day supply. Cigna offers a lot of programs to support your health. Cigna offers a culture of well-being and a lot of programs that support that. They offer educational and clinical programs to support you. Care management, if you have diseases such as diabetes or cancer or anything that is a chronic condition. They also offer online lifestyle management programs. There's a lot of resources at your fingertips. MyCigna.com has a ton of information, and there's also a mobile app, MyCigna app. There's 24/7 customer service, there's a 24/7 health information line, and there's Cigna Telehealth, which is telemedicine. We'll go through in another slide. There's workplace measures to promote healthy choices. Most of the information, again, is on Cigna.com. You will also get newsletters about healthy living, upcoming events, and many communications that you can look forward to. Cigna knows that being available to their customers is extremely important. You can call them anytime, day or night. They also have all your information on mycigna.com. Your claims, your benefits, if you need to order a lost card, frequently asked questions, all types of information on the site. Additionally, you can access the same information via their mobile app, and you never need to worry about finding your card again. It's all on Cigna mobile app. You need to find your doctor, your dentist, or pharmacy or facility, if you need to view or print your card, if you need to do a drug search. All this information about your plan is on the Cigna mobile app. Cigna's telehealth benefit gives you 24/7 access to a doctor via phone or video chat. You can do this from your home or work. You can do it day or night, weekdays, weekends, and holidays. This service is used for routine services such as colds, flus, headache, fever, pink eye, rashes, and many more. The cost of this service is that of a primary care copay, so it will range between $5 and $30. This is much less expensive than convenience or urgent care and much more convenient. Be sure to register for this service in advance so it's there when you need it. Cigna One Guide is an expansion of the mobile app. Based on your input, it provides support to help you use your plan. It provides proactive messaging based on your individual health needs. It creates a total personalized opportunity for you to gain the most benefit from your Cigna coverage. Cigna's health assessment is designed to be simple and fun, and a great way to learn about critical insights about your health. Cigna offers a great health and fitness app called Coach by Cigna. It's like having a team of health experts in the palm of your hand. Coach by Cigna gets you focused on what matters most in the 5 integrated lifestyle areas: exercise, food, sleep, stress, and weight. Download the free Coach by Cigna app on the App Store. It's important to know where you should seek care before you need to use it. Use the emergency room for true medical emergencies only. This is a risk to your life or your limb. You're having a heart attack, you had a bad accident, you broke your leg, that type of thing. That is the emergency room. Urgent care is for urgent yet not life-threatening situations. A child falls and maybe, not sure if it's a broken bone or not, if someone needs minor stitches, and generally if you're not feeling well, an urgent care center would be a good place to go. Convenience care is for less serious conditions. You walk right in and you get care right away. This would be for allergies and bronchitis, cold sores, influenza, burns, pink eye, that type of thing. As a reminder, you could also use your telemedicine benefit for these types of situations. It's also important to use the most appropriate healthcare professional. You can find doctors and hospitals and any type of professional on Cigna.com or your Cigna mobile app. If you're not sure where to go, sometimes it's a good idea to use your primary care provider. Although not required to assign one, you can use them to direct your care. Cigna uses preferred labs of LabCorp and Quest Diagnostic. And what is most important is that you use a professional who participates with the Cigna network. You can go out of network with your plans, but it's subject to a separate deductible, out-of-pocket, and balanced billing. You want to get information on the cost treatment of care before receiving care. On mycigna.com, you can get cost estimates for over 200 medical procedures. Although your plan does not require referrals, it does require authorizations on certain services, such as inpatient hospitalization, outpatient surgery, pain management testing, and imaging services. Your doctor will normally take care of this for you, but it's not a bad idea to make sure that he has taken care of this prior to your procedure. Just as a recap, remember these tips to help you save money. For prescription drugs, find your complete list of medications on mycigna.com and make sure you convert all your maintenance medications, your 90-day medications, to mail order. Your care options, use the emergency room for true emergencies only. Don't wait to locate a convenient care clinic or urgent care clinic, and don't forget about the telemedicine benefit that you can do from the convenience of your home or from work. Your healthcare professionals, make sure that you choose the most appropriate healthcare professional for your care. You can use preferred labs to save money. And proactively, use the health improvement tools available to you. The health risk assessment, the Coach by Cigna, there's a lot of valuable tools that are available to you. And last but not least, make sure you get your annual preventive visit. We offer 2 dental plans through Cigna. Systems integration plays the majority of your costs, and this year, your costs have decreased. The Cigna network is a large national network. It can be found on mycigna.com. There's 2 PPO dental plans, a base plan with $1,500 of benefit that's very similar to our current Care First plan, and there's an upgrade with $2,000 of benefit and also an added feature of paying an additional amount to out-of-network dentists. Both plans cover orthodontia for children up to age 19 for a $1,500 lifetime limit. A main difference between the plans is the reimbursement to out-of-network providers. The base plan pays out-of-network providers based on the in-network fee schedule. So you will want to stay in network with this plan. If you go out of network, there will be significant balance billing if you use a provider who does not take Cigna. The upgraded plan has been upgraded to have a higher reimbursement schedule. So if you are using a provider who does not take Cigna, you will want to take this option. You will find providers on mycigna.com. The Cigna DPPO network is the network that we use for both of our dental plans. We have more than 136,000 unique dentists in the network with over 380,000 office locations. You will receive better discounts if you use the Cigna DPPO Advantage network. This is a subset of the PPO network. This will be identified on the Cigna website, and that will be something you want to consider when you're using providers. This spreadsheet shows the Cigna dental options side by side. We have a base plan and an upgrade. You will note with both of them that the rates are lower than they are currently. The base plan is closest to what you have now with Care First. It has $1,500 worth of benefit per person per year. Preventive services are covered at 100%, basic services, which are cavities and fillings, covered at 90%, and major services, which are your crowns and your bridges, and includes implants, are covered at 60%. Out of network, it's a lower coinsurance amount, which means that you pay more, and there is also the high potential for balanced billing because the dentist does not participate with the Cigna network. There's a low out-of-network reimbursement schedule. On the upgraded plan, we have $2,000 worth of benefit per year, and we have a high out-of-network reimbursement. If you're using a dentist who does not take Cigna, you will want to choose the high plan so that you do not have a lot of balance billing. Note that our deductible starts November 1st. It's a contract year deductible. We're excited to introduce vision benefits for the 2017 plan year. An annual eye exam is extremely important. It's not just for your glasses. A good eye doctor will catch diseases such as cataracts, glaucoma, macular degeneration. Be sure to get your eye exam every year. So let's look at your Advanica vision benefits. Systems integration is also paying 55% of the employee and dependent cost for this plan. Providers, of which there are 15,000 optometrists, ophthalmologists, and chains nationwide, can be found on advanicabenefits.com. The in-network annual eye exam is a $10 copay, and you can also receive up to $150 towards frames or elective contacts. Discounts on laser vision correction. Note that discounts are taken at the time of service, and there's no paperwork needed if you use Advanica providers. If you do want to go out of network, you would pay in full, and you could submit the claim to Advanica for limited reimbursement. Another great thing about your Advanica vision plan is that you have plenty of choices. Providers can be found on advanicabenefits.com. If you stay in network with your Advanica vision plan, you will have great benefits. You have a $10 annual eye exam and receive up to $150 for frames or contacts. Frames are covered every 24 months. There is a $10 materials cost that also apply to most items, and there are discounts on laser surgery. If you do wish to go out of network, there is a limited reimbursement and you will need to file a claim. As you will see, the costs per pay are very low and heavily subsidized by systems integration.
Take a look at your ancillary benefit package. Your ancillary benefits, primarily life and disability insurance, are broken into two sections. The first section is the employer-paid life and disability benefit package. That is 100% paid for by systems integration. Systems integration provides all full-time eligible employees with 100% paid life insurance. The amount of benefit is equal to 1 times your earnings to a maximum of $100,000. This is guaranteed issue, meaning there is no medical questions or underwriting requirements for benefits to be in place. The accidental death benefit doubles the benefit in the event of accidental death. The most important asset that most individuals have is their ability to earn a paycheck. So disability is paycheck protection. Disability insurance is paycheck protection. So your employer provides you with short and long-term disability. So we'll talk about short-term disability first. Once you've been employed for 1 year, you're eligible for systems integration's short-term disability benefit. Benefits kick in after a 7-day elimination period or waiting period for sickness or injury, and they're payable at 60%. Benefits are 60% of your gross income to a max of $750 a week, and benefits can be paid to a maximum of 12 weeks. Maternity is included, And again, there is no cost to the employee for this benefit. Long-term disability insurance is also paid at 100% by systems integration for all full-time eligible employees once they have met the eligibility period for this benefit, and that is the first of the month following 30 days of employment. The benefit for long-term disability is designed to kick in after an elimination period of 90 days of disability. So after 90 days of disability, the benefit payable is 60% of gross income to a max of $5,000 a month, and that benefit potentially could be paid to a duration of age 65. There is a pre-existing condition limitation on the long-term disability benefit, which states that if an employee prior to their eligibility in the prior 3 months had a pre-existing condition, then that condition or anything related to that condition would not be covered as a disability for the first 12 months of coverage. An example of someone had a heart issue, they were taking medication for their heart in the prior 3 months of eligibility, and then during the 12 months they suffered a heart attack. It probably was related to that condition and would likely be defined as a pre-existing condition and therefore not payable. However, if they had another condition unrelated, such as cancer, with no prior history, then that condition would be. At the end of 12 months, the pre-existing condition limitation goes away, and any pre-existing conditions would be then therefore covered the same as any other illness. We've already talked about employer-provided life insurance, but on top of that, there's also voluntary term life and AD&D. So it gives employees an opportunity that if they need additional life insurance, they can purchase a certain amount with no questions asked. A simple process of enrolling and paying through payroll deduction. So for voluntary life insurance, during the initial eligibility period, all eligible employees can apply, again, no medical underwriting, for up to $100,000 on themselves, as well as $25,000 on their spouse and $10,000 on their child or children. It's the same rate whether you have 1 child or 10 children for the child rate. The important thing to know here is that in order to have the coverage on your spouse and children, it can't exceed 50% of the employee election. So if you were putting $25,000 on your spouse, you would need to have at least $50,000 on yourself. You can purchase in increments of $10,000 of coverage, and it's up to 5 times your earnings is the maximum amount that you can purchase to a max of $500,000. But again, it's a multiple of your earnings to a max of $500,000. And again, the guaranteed issue amount for initial underwriting, initial benefit when you first apply and you're first eligible, is up to $100,000. That's with no questions. However, once you have the coverage, you can purchase each year $10,000 increments with no questions asked, and you can continue to do that each and every year. At some point, when your benefit exceeds or reaches $100,000, you would need to go through a simplified underwriting process one time, and that would again extend the opportunity thereafter each and every year to protect your insurability and add $10,000 increments. So we hope you'll take advantage of this benefit. It's available to you, and it's a great benefit offered through your employer. Additional voluntary benefits available through Sun Life Financial are critical illness and voluntary accident. So both of these benefits have some common aspects to them. Both are designed to fill gaps that occur when critical illness or accidents strike that create significant additional expenses. And these expenses might fall outside of what's needed in the way of medical insurance and disability insurance. Disability is going to take care of those major bills and the expected expenses from not having a paycheck because you're disabled. But if you're to the point that you need to travel to and from treatment, possibly again to cover high deductibles on the medical side, or some of these other unexpected expenses, these two contracts both are designed to fill gaps. The voluntary critical illness pays lump sum benefits for critical illnesses such as a heart attack, heart failure, stroke, coronary bypass surgery, and it also includes benefits for blindness, end-stage kidney disease, and invasive cancer. So I would look at both of the packages on the voluntary accident and the voluntary critical illness and see if it fits into your needs. Employee Assistance Program, EAP, is often overlooked, but it's a very important benefit available to you and your family. It's a comprehensive program to help you manage personal and work-related problems. It provides a 24-hour access to professional advice, but it also offers up to 3 face-to-face mental health sessions with a counselor per calendar year. You can use this service for a number of things. Really anything that would impact your productivity or keep you up at night is probably something that's available to utilize this service. Example, problems with debts and you want to have debt management, or a legal question. Certainly any mental health issues such as a child having problems in school. Your parents are elderly and you need information about navigating long-term care. Your children lost daycare and you need to find a professional daycare in your area and you need some assistance there. So it's a very broad-based service and again available 24/7. So we hope you'll take advantage of EAP. Let's look at a few more benefits, additional benefits included at no cost to you with your Mutual of Omaha policy. First, worldwide emergency travel assistance. This is the benefit that as long as you're traveling at least 100 miles from home, that can help you with everything from prescription replacement to guaranteed hospital admittance. It would include translation services if needed. It's a great benefit for travel. You also have identity theft assistance, which is becoming obviously a lot more popular these days, providing you with education and prevention guidance and tips to help avoid identity theft, but also recovery, information, instructions, and guidelines in case it does happen to you. Case managers are available for assistance 24/7. We also suggest that you go online with identity theft assistance and register your credit cards. There's online will preparation. So for those of you who don't have a current will, it is state specific. You'll have access when you go online to a free online will prep service. You answer a few simple multiple choice questions on your computer or your smartphone, and you can download and print the document instantly. Anytime you have information about a life change, you get married, a divorce, a birth of a child, and you want to make updates, you can go online and you can do so. So it's a great service. These are 3 great additional benefits through Mutual of Omaha, paid for by your employer, Systems Integration.
Please take the time to review all your benefits carefully so that you make the best decision for you and your family. Everyone who is a full-time employee of Systems Integration working 33 or more hours per week should complete a Kelly election form. On this form, you're going to indicate whether you want to elect or to waive coverage, medical, dental, and vision. You'll notice that the life and disability coverages are blackened in because those are employer-paid benefits. Please note that you will also receive a separate enrollment form for voluntary benefits. That is a separate form that you would need to complete if you want any of the voluntary benefits that are offered by Systems Integration. Please complete all the forms legibly and sign, date, return to HR. Thank you. If you are electing medical, dental, or vision benefits, we also ask that you complete the POP, the pre-tax authorization form, that allows Systems Integration to deduct your portion of the premium on a pre-tax basis. Please submit all forms to HR by Monday, October 23rd. Don't miss the deadline. That's when open enrollment ends, Monday, October 23rd.